Hello, my name is Dr. Terry Scavage. I'm a forensic and clinical psychologist, and today I'm going to be giving you a presentation on referring for fitness for duty examinations, when to do it, when not to do it, and how to do it. Over the past few years, this has been a increasing consideration, and I can tell you that, at least anecdotally, the number of referrals for fitness for duty for mental health issues at work or potential mental health issues at work has probably increased about threefold since the pandemic, as we sort of enter the, ripple effects of that situation on people's mental health. And so I think that this evaluation is fairly timely, and I hope that it'll be helpful for those of you who have to make these determinations about whether or not a fitness for duty evaluation is appropriate, and then also the appropriate ways for going about that. So before we dive into the presentation here, I want to give you an overview of the agenda. First, I'll provide a little bit of information about my background, and then we'll dive into what triggers a fitness for duty evaluation, and it is triggered in fairly specific circumstances. We'll then review a variety of case examples that are sort of inspired by different situations that I've seen throughout my experience when it comes to fitness for duty evaluations. We'll talk about what a fitness for duty examination looks like and what the potential outcomes of that examination are. And then we'll discuss what the re-examination or the return to work evaluation looks like. Talk a little bit about logistics. And then at the end, I'll provide my contact information so that you could follow up with any questions that you might have. And I'm happy, by the way, to answer questions by email, phone, whatever you like is totally fine. So first, going into my background. So I grew up in Northeast Ohio and attended John Carroll University, which is a Jesuit Catholic college. Earned my degree in psychology from John Carroll, my bachelor's degree. And then I did my clinical training to become a psychologist at Kent State University. The way clinical psychology doctoral programs work, and most psychology doctoral programs in general, is all students are assigned to a mentor who's a faculty member within the department, and that mentor oversees the students' training and research. And my mentor at Kent State was a psychologist by the name of Yosef Ben Poreth, who is the test author for the most widely used measure assessment of psychological problems, the Minnesota Multiphasic Personality Inventory, MMPI. So I got a lot of experience and training in psychological testing, particularly with the MMPI, which is really commonly used in fitness for duty evaluations to assess for potential mental health problems. The nice thing about the MMPI, by the way, not to get too into the weeds here, but the nice thing about the MMPI is it has measures of whether or not somebody is being honest in their report of their psychological problems, which is extremely relevant in fitness for duty evaluations, because typically people want to get back to work, and they are incentivized to minimize their problems in an effort to get back to work. So it's good to be able to detect that with psychological testing. I did my much of my training in terms of my clinical training at the Summit County Common Pleas Court, which is a criminal court for Akron, Ohio, and helped with a lot of different evaluations for forensic assessment, like competency to stand trial, not guilty by reason of insanity, those sorts of evaluations, and that's really where I've cut my teeth as a psychologist, is in criminal forensic settings where we see a lot of severe mental illness, disturbed personalities, and just learn a lot about the extent and depth of different psychological problems. All psychologists who are clinical psychologists have to complete a 1-year practical internship full-time in order to earn their degree in clinical psychology and eventually get licensed as a psychologist. I completed my internship in Southern California at a large state hospital called Patton State Hospital, which is actually the largest state hospital west of the Mississippi. It had 1,500 patients, all there related to court proceedings. Many found not guilty by reason of insanity and then committed to the hospital for ongoing care and safety. So I got a lot more experience of forensic assessment there. Went back to Kent State University after that for a 2-year fellowship, helped with the development of the newest version of the MMPI, the MMPI-3, that psychological test we talked about earlier. And then eventually went on to teach for several years at my alma mater, John Carroll University, where I eventually, where I was a full-time professor, and I eventually earned tenure, which is a job for life at John Carroll, and I earned it in 4 years. Normally it takes 6 years. I think I was the quickest ever to earn tenure at John Carroll University, and it's over a 100-year history. And about 2 months after I earned tenure, I had this job for life. I decided that I didn't want to be in academia anymore. I didn't want to be a professor anymore, at least not full-time. And that around that time is when I started to practice Cleveland psychological testing and really just focus exclusively on psychological assessments. And as a professor in my part-time, on the side, I was continuing to do forensic assessments. So this was really just a switch to doing that full-time. And it's really been excellent because there's been a huge need for lots of different forensic assessments, including fitness for duty assessments. And I feel very humbled to be able to meet that need. All right, real quick, a little bit about me personally. So I have a 7-year-old son who keeps me quite busy. He's younger there, obviously, because he's wearing diapers. He doesn't wear diapers anymore. And keeps me quite busy, play a lot with him, play a lot of video games, do a lot around the house. Between that and the practice, I'm often tired. And I like to sleep. I'm a huge Cleveland Browns fan, have been my whole life. And I also brew beer. That is a thing. You can homebrew beer, and it's also a thing that you can submit these homebrew beers to competitions where they're judged. And I've actually had beers entered into the national homebrew competition and medaled in that competition. And the style of beers that I medaled for were called IPAs. So Northeast IPA and a classic IPA both took home medals in that. So I like to do that in my spare time as well. All right. So that's a little bit about me. Now, what I am not, though, is an attorney. Okay, I just want to make that very clear. Throughout this evaluation, with forensic assessments in general, forensic just means psychological assessments applied to different legal situations. With forensic assessments in general and fitness for duty evaluations in particular, there's a lot of legal considerations, regulatory considerations. I'll be alluding to these and describing these legal considerations, but as I do so, please do bear in mind that I'm not an attorney, and of course, always seek out your own counsel. All right, so let's get into what triggers a fitness for duty evaluation. So this is it. These are the 4 main areas that we want to be mindful of when determining if a fitness for duty evaluation makes sense, both from a safety standpoint, professional standpoint, as well as from a legal standpoint. So the referral for a fitness for duty evaluation starts with a reasonable belief. Okay, the key word there is reasonable. Okay, a reasonable belief is not necessarily accurate, right? But a reasonable belief is reasonable based on the information available. And this concept of reasonable belief comes up in lots of different situations within the law. And it'll oftentimes be discussed as, what would a reasonable person think? What would a reasonable person do? It's not, explicitly well defined. But basically, what reasonable belief means is sort of common sense, right? So this all starts with a reasonable belief, a common sense sort of belief, that there's these concerning behaviors that could be due to a mental health condition and could cause some sort of risk. So let's talk about concerning behaviors that could be due to a mental health condition. And the key operative word here is behavior. Okay. Behavior being actions or statements. So concerning behavior includes things like hostility, shouting, tearfulness, odd behavior, particularly if it's different than the person's baseline behavior. Peculiar statements, suicidal or violent statements, threats of hurting oneself or others are definitely should be taken seriously. Changes in appearance and absenteeism, making other people uncomfortable, smelling of alcohol or drugs, is a pretty obvious one. And then major changes in performance. Those are all concerning behaviors that could be due to a mental health condition. Some of the most common mental health conditions that I see, the three most common, are depression, anxiety, and substance abuse. And then in some cases, you do have people who are manic due to bipolar disorder or psychotic due to a psychotic disorder such as schizophrenia, and that could lead to problems as well. Those are more rare, but that happens too. And then the key here is that you have to be concerned about some sort of risk. Okay, and there's three particular types of risk that relate to the need for fitness for duty evaluation. A fitness for duty evaluation is indicated if there's a reasonable belief of concerning behaviors due to a mental health condition that lead to an increase in risk in terms of impaired ability to effectively and safely carry out the essential job duties, suicide risk, and violence risk. Okay, so the three main areas here are doing the job effectively and safely, harm to self, harm to others. Those are the three main concerns. Now, what we're going to do next here is walk through some case examples and make determinations based on this, model here of, whether or not a fitness for duty evaluation would be warranted. All right, first case example. And again, these are all sort of inspired by situations that I've seen and consulted on over the years. Case example 1. 2 coworkers have been arguing in the workplace. It is making everyone around them feel uncomfortable. Supervisor comes to you and says, hey, do you think we should do a fitness for duty evaluation? FFDE stands for fitness for duty evaluation. You tell them it should not be conducted. Why do you tell them that? Why should it not be conducted in this situation? Well, it sounds like, at least from a common sense perspective, that what's most likely going on here is some sort of personality conflict, right? So this is a personality conflict, or at least most likely a personality conflict, not a mental health problem, so it wouldn't indicate necessarily the need for a fitness for duty evaluation. So office politics, office dynamics, all of that, really should be taken into consideration. And in this situation, it's possible that actually there is more going on here, and maybe there is a mental health condition or conditions at play. But in order to determine that, you'd have to get more information, right? So certainly, we'd have some concern with this situation, but we would need to do some more investigation and gather some more information to make a determination if there's a reasonable belief that there's these concerning behaviors due to a mental health condition that increase risk of job ineffectiveness or safety. All right, case example number 2. A supervisor brings a concern to you. A female nurse has complained about a male doctor, quote, creeping her out. He has been texting her outside of work about how he believes she is his wife, quote, from a past life. She initially thought he was joking, but he keeps bringing it up and staring at her in a way that makes her feel uncomfortable. He has been no call, no showing to work, sometimes wears muddy shoes into work, and also his wife unexpectedly died a few months ago. You suggest a fitness for duty examination in this case. Why? So, the issues at play here are, first of all, there's some concerning behaviors here, right? We have the muddy shoes. We have these texting the woman outside of work. We have changes in work performance, right? Where he's been no call, no showing to work. And then he's also making a coworker feel threatened, understandably so, by the way. So we're checking a lot of boxes here in terms of these concerning behaviors, right? So we're checking a lot of boxes in terms of concerning behaviors. Very well could be due to a mental health condition, maybe some sort of psychotic condition. And this is certainly going to, raise concerns about violence risk or, towards that nurse. And also the person's ability, the doctor's ability to effectively carry out his job duties. And based on what we have here, a reasonable person would say, we should do a fitness for duty evaluation. It meets the criteria. It's just sort of common sense, right? All right. Case example number 3. An employee took FMLA and was psychiatrically hospitalized for 4 weeks while out of work. Her psychiatrist has cleared her to return to work and to return from her FMLA leave. The employee's supervisor finds out that the reason they were hospitalized was these psychiatric issues and wants the employee to complete a fitness for duty examination. For that reason, you tell them this is not possible. Why? Why, based on the information that we have here, would it be inappropriate to refer this person for a fitness for duty evaluation? Well, first of all, I suppose it is concerning that somebody has been psychiatrically hospitalized, but that's outside of work. There's no indications that this person has had any problems, significant problems at work, and they're having a mental health professional sign the paperwork for FMLA, giving the opinion that they're okay to return to work, they're cleared to return to work. So we're running into you would run into some legal issues by having this person undergo essentially another evaluation. And also you had some issues there in terms of privacy with, subjecting them to an unnecessary, potentially fitness for duty evaluation because the psychiatrist has already cleared them. And then you also run into the issue of potentially being accused of discrimination based on a medical condition. And, according to the Americans with Disabilities Act, you can't use that medical information alone as a reason for, holding a person up from returning to their position. And this has been argued in the courts. There's a case here, Albert v. Runyon. The judge ultimately ruled there that a fitness for duty evaluation cannot be completed while an employee is on FMLA leave. So that's something to keep in mind. Now let's look at this from a different angle. Let's say we get some additional information. Okay. An employee took FMLA and was psychiatrically hospitalized for 4 weeks. Her psychiatrist has cleared her to return to work. The employee's supervisor has concerns about the employee returning to work. The supervisor reports that in the days before taking the leave, the employee was telling coworkers that she was considering suicide and that she was tearful at work. You agree that a fitness for duty evaluation makes sense in this case, but note the employee should be reinstated first. Why do we do this? Okay. In this case, we have concerning behaviors that happened at work. We have fairly clear evidence of potential job impairment, of impairment in completing the essential job functions. And going back to Albert and Runyon, that case, they did rule that you can do a fitness for duty evaluation in a situation like this. It just has to be completed after the employee is reinstated to their position. So it's really just a matter of a timing issue where they have to be put back into their position, and then once they're formally back in their position, then they can be put on leave, have the fitness for duty evaluation completed. So in general, things are kind of tricky when it comes to FMLA and fitness for duty evaluations, but a fitness for duty evaluation can be completed after FMLA if the need for the evaluation is job related. For example, there's issues before the person was put on leave. Or if as an employer you routinely obtain those sorts of evaluations upon return to work. In other words, this isn't just an isolated case. Or the employee's treatment provider gave an unclear or confusing certification for return to work. In those cases, the court has ruled that you can do a fitness for duty evaluation to get your own opinion. Now, in general, with all this, it's a good idea to consult an attorney, get their perspective. Things can get weird with FMLA. All right. But that doesn't mean that it can't be navigated around or you can't do the fitness for duty evaluation when you really need it. It's just there's some considerations about how to do the fitness for duty evaluation. All right, next case example. An employee is filmed on camera attacking another employee. They've been tearful at work and their mother just died. The supervisor comes to you asking if a fitness for duty examination should be conducted. What do you tell them and why? I mean, I don't know about you, but I would tell them this person is fired because they assaulted someone. The employee engaged in illegal behavior, certainly behavior that's grounds for termination. It probably doesn't make sense to do a fitness for duty evaluation here because honestly, you should probably just fire the person, terminate them, right? And fitness for duty evaluation should only be completed if, as the employer, you have a good faith intention to keep the person, right? If you're planning on terminating them, then it wouldn't make sense to subject them to a fitness for duty because the ultimate goal of a fitness for duty is not only to determine if somebody is fit to work or not, but then to outline the plan to get them, if they are unfit, to outline the plan to get them fit to return back to work. So fitness for duties are for people who you're expecting to keep as employees, not ones that you should probably terminate. All right, next example. An employee has been working in the same role with the employer for 4 years. They were recently assigned a new manager. The manager notes that the employee is very slow in completing tasks, complains to them all the time, and is rude to them. The manager is beyond frustrated with the employee. They want a fitness for duty examination on this employee. You tell them that a fitness for duty exam is not appropriate. Why do you tell them that? What's the key change here? There has been a change in the employee's behavior, or at least the perception of that behavior. But there's also been a change in the manager, right? So really what we have here is changes in the manager. And probably the employee's behavior is the same and potentially not problematic. It's just the manager's perception or the manager's standards have changed. And that's something to be careful about. Is when a new manager comes in and then issues arise potentially due to a psychological condition, it's important to be wary of. It could just be the personality dynamics, the interpersonal dynamics are different, and that's leading to some tension and problems, and it's not a mental health problem. All right, another example. Has been working in the same role with the employer for 4 years. They were recently assigned a new manager. The manager said the employee is screaming at them in meetings, stomping around the office, and purposely wearing perfume that is causing him an allergic reaction. A lot of these are actual examples of things I've heard from managers, by the way. The employee recently filed a grievance against him with HR. You tell them an FFD exam is not appropriate, at least at this time. Why do you tell them that? What is the concern here? The concern is retaliation, right? So that fitness for duty exam, it should be completed, potentially. I mean, these sound like pretty, intense behaviors. But that fitness for duty evaluation should be completed after the grievance procedure is completed, because you have these concerns about retaliation, office politics. For all you know, I mean, right now you just have the manager's perspective, right? And what he's telling you, maybe he's the one that needs the fitness for duty evaluation. So I think that this situation illustrates a couple points. One is, you have to be concerned about retaliation. And two is, it's important to get multiple people's perspectives on the employee. Because if you just have only the manager's perspective, for example, who knows why people perceive the things they do, right? I mean, 2, 3, 4 people can all look at the same situation and perceive it very differently. And, our perceptions of a situation are not only influenced by what the other person is doing, sort of their stuff, but it's also influenced by our stuff, our own issues, our own biases. So it is important in general as best practice to get, follow up and get multiple people's perspectives on what's been going on before proceeding. All right. Case example, our last case example here, number 8. A supervisor brings a concern to you. An employee has been seen crying at their desk at work multiple times, and last week she no-called, no-showed for her shift. The supervisor sat down the employee, addressed it with them appropriately. Employee broke down in tears during the meeting. And then yesterday she showed up 45 minutes to her shift, was noticeably disheveled, and had no good reason for being late. They come to you, they don't know what to do. They don't know if perhaps there should be some sort of disciplinary action. What you do is you recommend a fitness for duty exam. Why is that? Well, we have these concerning behaviors of tearfulness, changes in work performance, no call, no showing, showing up late, and all of this very well. I mean, anyone of common sense, could sort of figure out that this very well could be due to a mental health condition, maybe depression. So it makes sense to do a fitness for duty evaluation. And this illustrates, I think, one of those situations where, sometimes there's different options on the table. One of those options is disciplining somebody, but they may be going through a rough time. And as I said earlier, mental health is just getting worse and worse. I mean, it's really getting severe. Suicide rates, doubling, tripling, overdoses. It's getting bad. And people are in a lot of pain and in rough shape. And, sometimes rather than disciplining someone, it would make sense to get them involved in this fitness for duty evaluation process. Whereas we'll talk about, the goal is not only to give an opinion about whether or not someone's fit or unfit, but to give them that path forward if they are unfit to become fit, to be better at their job, more effective at their job, and really just to be happier, better adjusted people. So that's been my experience is more often than not, in the vast majority of the cases, for people who are unfit, it ends up being a really positive thing in the long run that they got these evaluations, as opposed to just being fired or being disciplined. All right, so let's talk about how to move forward when you have some sort of situation and you're trying to determine if a fitness for duty evaluation would make sense. When in doubt, get more information. I'd like for that to sort of be the one of the main take-home points for you is get more information. And what sorts of information do you want to collect? Focus on behaviors, the employee's behaviors. What is this person objectively doing? What are their actions? What are their sayings? What are they saying? Get quotes, get direct statements of what they said. Bear in mind that although other people's feelings and their perceptions of an employee, are valid, I mean, that's legitimately how they feel or what they perceived, they're not necessarily objective. They're not necessarily reasonable. It's not necessarily what happened. So if at all possible, get multiple perspectives, and that'll help too when referring for a fitness for duty evaluation, for the evaluator to have those multiple perspectives. So that would be my main take-home point for you, is get more information. Also, when in doubt, get consultation, okay? Talk to peers, talk to supervisors, attorneys, psychologists who do these types of evaluations. If you're unsure of how to move forward, ask somebody, get your hand up, and hey, what do you think? Go to the experts, go to your peers, get that consultation. And more times than not, or almost always really, you figure out by the end of that consultation if it makes sense to move forward with the fitness for duty or not. And again, just to review, what triggers the fitness for duty evaluation? When would it make sense to do it? It's when we have a reasonable belief, doesn't need to be 100% accurate, just needs to be a common sense belief, that there's these concerning behaviors that could be due to a mental health condition, and that those could increase the person's risk of being ineffective at their job or unsafe to themselves or others. Okay, so we've talked about referring for fitness for duty evaluations, when to do it. Now, what actually happens in the fitness for duty process? I'll walk you through what these examinations look like now. So the fitness for duty evaluation starts with your concerns as the employer, right? And it'll start with a conversation it should start with a conversation between you and the psychologist about what the concerns are, what the behaviors are that are, leading to the fitness for duty evaluation. And then the actual evaluation itself, I could speak to how I do these evaluations, and then that generally coincides with how other psychologists do their evaluations. The first thing that I'm looking at and collecting in my evaluations, which lasts about 3 hours, is getting background information from the employee, what we call their social history, where they grew up, what their education was like, marriage, kids, medical problems, legal problems, basically getting the whole background. Then the next step is psychological testing. Most of the time it's psychological testing for mental health problems. Sometimes it'll also be psychological testing for cognitive problems, depending upon, what the concerns are that the employer has. And then there's the interview with the employee, focused upon what led to these concerning behaviors. So at least when I do these evaluations, I'll spend 1 to 2 hours just talking to the employee, hyper focused on, say the week leading up to the concerns, the day the incidents happened for which they were referred, just hyper focused on what was going on there. And the goal of all of that and all of the other information is for me to get a clear understanding of why this happened, of why these concerns are occurring. Because it's only if we're able to identify the why behind the concerns that we're able to identify how to treat the issues and eliminate the concerns in the future. And then at the end of the process, I have what's called my conceptual formulation, essentially just writing down why this event happened, why these concerns are occurring, and then how that impacts impairment in one's ability to do their job, suicide risk or violence risk. Again, those 3 key areas that we are concerned with when doing a fitness for duty evaluation. And when you get the report as the employer, there'll actually be 2 reports that are written. There'll be one long report that includes all of this information, and that'll be, anywhere from 6 to 8 pages long. That stays in my file or in the psychologist file. And then what the employer gets is a synopsis, essentially. That's 1 to 2 pages, and will just include the conceptual formulation part. That just the explanation of why these concerns happened at work, if they lead to some sort of job relevant impairment or suicide or violence risk, and then finally, if somebody's not fit, the recommendations that I have, or the psychologist has, that are designed to get the person back to fitness. And what I'd like to point out here is that this whole process begins with the employer concerns. And the whole process is designed to be able to explain and consider those employer concerns. So the more comprehensive those concerns are, or the description of those concerns are, the better, right? The more information you can give the psychologist up front, it'll put them in a better position to address your concerns and figure out, what's going on. All right. So, potential outcomes of a fitness for duty evaluation. So when somebody's referred, the report is written, and at the end of the report, there's 4 potential outcomes, 4 potential opinions that the psychologist can provide. First one is fit for duty. That means person is clear to return to work from a psychological perspective. They're ready to go back. Next would be fit for duty with treatment recommendations. This is not uncommon. So this would be something like, this person's cleared to return to work. They're fit for duty under the condition that they seek out counseling, or that they maintain counseling that they've already begun. And this is something that I'll do commonly because, sometimes people will be experiencing, they'll be fit, but they'll be under a lot of stress. And in order to make sure that their fitness is maintained, they should have that counseling, to focus on reducing stress. So fit for duty of treatment recommendations, good to go back, but should also seek some sort of treatment as well. And then there's unfit for duty with treatment recommendations. This is a situation where, when someone's unfit for duty, they're not cleared to return to work, they're held off work, they're continued on leave. And then, by the way, before I forget, if you're going to refer someone for a fitness for duty evaluation, while you're waiting for that fitness for duty evaluation, make sure that the employee is on leave, okay? Because if you're concerned enough about an employee's behavior to have their fitness for duty assessed, then it would be optically bad and sort of irresponsible to keep them on the job while having those potential concerns. So one thing that is just one thing to note. But turning back to this point with the fitness for duty evaluation, again, one of the opinions that I can offer, any psychologist can offer, is unfit for duty with treatment recommendations. This means that the person is not fit for duty. They're continued on leave. They're not cleared to return to work. And then there's a variety of different treatments that are recommended designed to restore that person to fitness. And normally it takes anywhere from 1 to 3 months to complete those treatments. And then, as we'll talk about in a moment, once the employee completes that treatment and assuming they comply with it, they're reevaluated. And in most cases, they're ready to go back to work after that. Now, the last potential opinion that can be given in a fitness for duty evaluation is unfit for duty with no treatment recommendations. So in other words, they have a poor prognosis and treatment is not going to help them. They're unfit now and they're never going to be fit in the future. This is most common when you have individuals who are referred for cognitive problems like dementia. Like if you have an aging employee who's developed a dementia and it's interfering with their job performance, and they come to see me and they're unfit to do their job because of that dementia. Unfortunately, that dementia isn't going to get better or appreciably better with treatment. So if they're unfit because they have dementia, they're never going to be fit, and that's the end of their career, at least in that particular position. Now, common recommendations that you'll see psychologists provide, could be a psychotropic medication evaluation by a psychiatrist, and then maintaining compliance with those psychotropic medications. Individual counseling is another common recommendation. IOP treatment is something that I commonly recommend. IOP stands for intensive outpatient treatment. And these are typically 6-week programs where patients go in for normally 3 days a week, 4 to 5 hours a day, and they get this intense treatment, which just means they have a combination of like group therapy. They have their medication provider rolled into these programs. They have individual counseling rolled into these programs, and then they have like education about mental health and ways to deal with mental health. Basically, with an IOP program, somebody's getting 10 to 15 hours of treatment a week for 6 weeks. So you can basically sort of like cram in, what would normally take a year if they were, just going to one-to-one counseling every week. You can cram all that into a short period. And that's why I really like it for fitness for duty evaluation, fitness for duty situations, because you can get people better faster and back to work faster. And that's, something that the employee wants. That's something that the employer wants. I mean, it's a win-win for everyone. And even though it's called intensive outpatient, it's not necessarily just like severe cases that go there, like schizophrenia or bipolar disorder. It's just that it's intense in the sense that there's a lot of treatment intensely packed into a short amount of time. So I really like IOP for these situations. And then, if someone has substance use issues, you might recommend substance abuse treatment, attending 12-step meetings, or sobriety as verified by urine drug screens. So these are commonly what you'll see in terms of recommendations. And then we have the re-examine/return to work evaluation. This is when people have been found unfit for duty and they have a good prognosis. They've completed all the treatment that's been recommended by the psychologist, and now they're going to be reevaluated to make sure that they're ready to return to work. And really, there's 3 main areas that at least I focus on in these return to work evaluations. First is insight, and what insight refers to is the person's ability to appreciate that they have a mental health problem that needs certain treatment, and an understanding of what treatment they need to stay stable. So that's important, because there's plenty of people who have mental health problems and do their job effectively. The key is that they take the steps necessary to manage that mental health problem, just like as is the case with a physical health problem, where people have to maintain these things in order to maintain their fitness. I'll test their mental status, observe their mood, see how much they've improved as a result of treatment, ask them how treatment went, have them go through that. And the vast majority of the time, people are feeling substantially better at this point. Employees are feeling substantially better. If they were upset at first about being held off work, oftentimes they'll tell me at the return to work evaluation, like, I was upset, but I kind of needed that, and I actually feel a lot better, and thank you for that. So it tends to be actually a pretty nice moment where most people are ready to go back. Logistical considerations. So first of all, when it comes to consultation, I'm always happy to provide, free consultation. That's totally fine. I love doing that. Feel free to give me a call for that consultation. My number's here. My extension is 6 if you want to get to me directly. And you can email me as well. Happy always to provide that consultation. In terms of documentation, what you need to provide the psychologist who's doing the fitness for duty evaluation, there's people have different preferences, but the bare minimum is you have to give them a copy of the employee's job description. The reason for that is if I'm trying to determine if this person is impaired in their essential job functions, I have to know their essential job functions, and that's laid out in the job description. And then that description of the concerning behaviors that led to the referral. And the more detailed that is, the better. Okay, because a fitness for duty evaluation, really what we're focused on is determining the cause of the behavior in that letter. All this information should be sent prior to the appointment. At least for me, it doesn't matter to me when or how long before the appointment. As long as I get it before the appointment, that works for me. In terms of reports, that varies by provider, but I could tell you, for me, typically the referral source gets the report for me in 3 business days. Normally, I can get people in within 1 week. I really try to speed up these appointments because people are out of work, and I speed it up for the employee's sake and the employer's sake. And then sometimes there's leave paperwork that needs to be completed, like FMLA or short-term disability. I can do that. I don't have to do that, but I can. Some psychologists who do these evaluations won't complete that paperwork because oftentimes the paperwork says, like, treating professional signature, for example. But in these evaluations, they're called independent medical examinations, so they're not treatment. They're purposely not treatment because, like, my job in these evaluations is to be independent. So I'm not, like, on the client's side like a treatment provider would be. I'm also not on the employer's side. I'm independent, objective, call it like I see it. As I tell people, I advocate for the truth. So oftentimes forensic evaluators won't complete that paperwork because of that, but I complete it, and then I just cross out treating from treating professional, and I make clear that it was an independent medical exam, and that's never been an issue before. That seems to work fine for paperwork purposes. In terms of communication, if you all are unsure of anything, you need consultation, please feel free to contact me. As I said before, it's always a good idea to run situations by your colleagues, by legal. And then the last thing that I would leave you with is not to let uncertainty about what to do get in the way of a needed referral. Because, as I said, mental illness is becoming more and more prominent. It's having a greater and greater effect on the workplace in terms of efficiency and safety. And these fitness for duty evaluations, protect people, right? They protect coworkers, make sure that they're safe. They help protect the employee. They help the employee, function better. And then, once they feel better, they're a more effective employee. So, all things being equal, I think, even though there's this stigma against fitness for duty and, oh my gosh, my employer thinks I'm crazy type stigma, it really isn't about that, at least not the way that I conduct them. It really is about just being objective, seeing if a person is a risk, and if they are a risk, then get them better so they can go back to work and not be a risk and live a better, more fulfilling life, So that's really the purpose. And with that, I would just say, if you have any questions, again, I'm happy to answer them. My contact information is here. You can, scan this little QR code here and get my contact added straight to your cell phone. And then here's my other contact information. And I appreciate your interest in this topic and the steps you're taking to be there for your employees and your employer. And again, if you have any questions, please let me know. Thank you for your attention, and have a wonderful rest of your day or night or whatever it is, whatever time it is for you. Thank you, and have a good one.